Good afternoon. Welcome to this collective conversation with James Pfeiffer, who today will be talking to us about the deepening debt crisis and public health in Africa. My name is Katerini Storing, and I lead the Global Health Politics group here at the University of Oslo, and also co-direct the collective for political determinants of health, which is co-hosting this event. The collective is now running a webinar series called Collective Conversations, in which members of our collective share new research and perspectives with a wider audience. And today's event is a hybrid event. We are here at the University of Oslo as well as online, and the webinar is also being recorded. Online participants can post questions using the Q&A function. And I think you can also raise your hand if you would like to be so-called elevated to speaker to pose your question verbally. And I'm now going to hand over to the chair of today's seminar, who is Professor Desmond McNeil.
He is part of our Collective's Advisory Council and will introduce our speaker. Thank you.
Yes, that's correct. Good morning, afternoon, or evening, depending on where in the world you're located. My name is Desmond McNeil. I'm an emeritus professor here at the Centre for Development and Environment at the University of Oslo. Today, we're very pleased to have with us Professor James Pfeiffer. And the title of his book is, quote, The Deepening Debt Crisis and Public Health in Africa, New Strategies of Resistance. James Pfeiffer is currently professor in the Department of Global Health in the School of Public Health at the University of Washington, Seattle, with a joint appointment in the Department of Anthropology. Dr. Pfeiffer was also Executive Director of Health Alliance International, HAI, for 10 years, where he oversaw public sector health system strengthening projects in Mozambique, Cote d'Ivoire, and Timor-Leste. He has 30 years of research experience in medical anthropology and public health in Africa. In his faculty positions at Cape Western Reserve University and University of Washington, Dr. Pfeiffer has served as principal investigator on medical anthropology and public health research funded by the National Science Foundation, Venegren Foundation, and National Institute of Health. James will speak for about half an hour, after which there will be time for questions. For those of you, indeed the majority, who are following online, you're invited to submit written questions through the Q&A, that is the chat function, on your computer, but you can also click the raise hand button on your computer to ask your questions directly. And if you do this, we will allow you to ask your questions directly on video. If I mess things up with the technology, my colleague Emma Sandvik-Ling will help me sort it out. So I give the word to you, James.
Hello, everyone, and welcome to all those at different parts of the world. Thank you for joining us today. And thank you for that wonderful introduction, Desmond. And I want to thank Katerini and Juan and Emma and all the others here that have made my wife, Rachel Chapman, who's also an anthropology professor for the University of Washington, feel so welcome here. So we're just really happy to be here. I wanted to start this talk. I have 30 minutes. I'm going to try really hard to get it done fast so that we can have some discussion. But I want to talk a little bit about my background so you'll understand from where what perspective I'm bringing to this work. As was mentioned, I have about 30 years of experience doing mainly health system strengthening kinds of projects, mostly in Mozambique, but also in Timor-Leste and in Cote d'Ivoire. And I've worked during this entire time for an organization called Health Alliance International, which is we acted as a non-governmental organization, an NGO, but we had one foot in the University of Washington as well. So sort of a hybrid organization over many years, about a 33-year history of HAI. And I became the executive director for the last 10 years of the organization. And in 2022, very importantly, we decided to hand over all of our projects and grants to local organizations that we had helped found and create. And I want to talk a little bit about this idea of localization today, because it is connected to the issues of debt and austerity. So that's what I'm bringing to this. I also thought I would mention that I am trained as a medical anthropologist with public health and epidemiology background. But why am I talking about these? Why am I talking about these very wonky political science, economic type issues. And I have Antoine on my right and Desmond on my left to correct me as we go forward. But as an anthropologist, I did a lot of on-the-ground work and saw the effects of debt and austerity in the Mozambique setting and how it complicated and made very difficult the provision of basic primary healthcare services in Mozambique. So I bring that lens to this. We just came to Oslo from Mozambique, Dr. Chapman and I. We spent about 10 days and I was conducting interviews with a number of people, both in the NGO world, but also in the Ministry of Health. And I'm going to be trying to update and report on what they told us about the terrible crisis that Mozambique is actually facing right now in its health services. So with that background, I want to start by highlighting a couple of African voices in this discussion, since I'm focusing on Africa. Many of you might be familiar with Thomas Sankara, who was president of Burkina Faso, 83 to 87, and was unfortunately assassinated in 1987, but was very much a Pan-African leader. And he made a speech on foreign debt way back, almost 40 years ago, to the Organization of African Unity in Addis Ababa. It's just a very powerful statement here. Debt's origins come from colonialism's origins. Those who lend us money are those who have colonized us before. They are those who used to manage our states and economies. Debt is neocolonialism in which colonizers transform themselves into technical assistants. That he said we should better say technical assassins. That's strong language. Under its current form, that is imperialism-controlled debt, is a cleverly managed reconquest of Africa. So I want to start with that African voice, and I think from many of our African colleagues, I've heard kind of similar sentiments voiced, that the kind of debt that's imposed across the continent has been a real yoke and burden for them. This is another quote from an African leader, Paulo Ivo Garrido, who was Minister of Health from 2005 to 2010 in Mozambique during the beginning of the HIV. Do you know Dr. Garrido? Yes, the people in the room are familiar with him. We worked pretty closely with him on the early scale-up of HIV care and treatment in Mozambique. And he came to the University of Washington to give a talk on the 40th anniversary of the Alma Ata Declaration in 2018. And we asked him, when he needs to expand his budget, what does he do? And he said he has to go to the Ministry of Finance, right? He has to talk to the Minister of Finance. And he said every time he went to the Minister of Finance to say, I need more funding to expand my workforce, he said there was the guy from the IMF seated right next to him, literally, in person. And they basically just say, no, you don't get any more money. Here's your budget envelope. You might have an HIV crisis, but no, you don't get to expand the scope of the health service. And so he said, there are no ministries of finance in Africa. There is just the IMF. So I thought that was quite a powerful statement to make. So just for those of you who may not be following all of this, we have entered into what most people watching these dynamics are saying is the worst international debt crisis we've ever faced. Worse than the one in the 1980s, worse than the one in the 1990s. We're now entering an extreme, desperate situation that has been provoked mostly by the COVID pandemic, but not only. And this is just a map showing the red are the countries in deep debt crisis currently. Depending on who you talk to, the IMF or Debt Justice or the different organizations, you have anywhere between 30 to 60 countries that are in deep debt distress. So we're facing a deepening problem, and the way out is complicated. So COVID intensified the debt crisis in 2022. This is from a World Bank press release. This came out at the very end of 2023, just chronicling how much money was $443.5 billion to service debt in 2022 across the global South, and shifting resources very directly away from health, education, other social services, and of course, mitigation of climate change, which is a huge issue now. So overall debt servicing costs for the poorest countries, sometimes spending as much as 39% greater in the last few years since the COVID pandemic. And there's been a number of defaults, sovereign defaults. So about 60% of low-income countries are at high risk of debt distress or already in. So this is from the World Bank. So during the COVID pandemic, there were some efforts, right? There was a recognition among the big, powerful actors that something needs to be done because countries are in deep free fall from COVID. And what I need to do here is take this off so I don't. Hang on 1 second here. There we go. Larry Summers, who I'm not sure if non-Americans are familiar with this fellow, he's notorious, Secretary of Treasury under Bill Clinton, but quite controversial. But a prominent prominent economist who has talked a lot about international debt issues, and he said this initiative called the Debt Service Suspension Initiative that was put out by the IMF and the G20, which would suspend debt payments for almost 18 months across the global south, saying to take this money you would spend on your debt repayments, put it into COVID mitigation. He said this debt suspension initiative is a squirt gun meeting a massive conflagration. And Jaime Atienza, who works for Oxfam, prominent leader in Oxfam, said the failure to cancel debt payments will only delay the tsunami of debt that will engulf many of the world's poorest countries. And that is what's happened, is that the debt has not been canceled. There was the debt service suspension that meant countries didn't have to pay back their debts. But by the end of 2021, they had to start paying again. That was soon replaced by something called the Common Framework, again, which is a G20 and IMF World Bank effort. The Common Framework was set up as a system through which countries could apply for debt relief through a sort of an organized new system. We're going to talk a little bit about that. It's not working very well, unfortunately. Only 4 countries have gotten through it so far in the last couple of years. Okay, that did not advance. Okay. So one of our colleagues in the collective for political determinants of health, Alexander Kentikelenis and Thomas Stubbs, have been writing extensively about austerity. So part of debt is that when countries are in debt, they have to cut their government budgets drastically, leading to regimes of austerity. And they have, I think Alexander Kentikelenis is one of the key scholars tracking all of this. And so he warned that 83 out of 189 countries will face contractions in government spending compared to their 2010 averages by 2023, but going into 2024. And basically, they're saying that what the IMF is doing, in fact, even though they're saying they want to avoid austerity, they're actually returning to extensive austerity measures and structural reforms in the post-COVID period. So we are in for the tsunami of debt, followed by the tsunami of austerity and reductions in spending that's going to have huge implications for population health. So just want a little plug for Alexander and Thomas Stubbs' book that just came out last year, 1,000 Cuts, Social Protection in the Age of Austerity, that puts together much of their research. And it's a fantastic book, well-researched, if you need to go more deeply into this. What's also emerged in the last few years, which has become a real problem, I want to focus a bit on that today, is that there are lots of different types of debt. But real quickly, global South debt. There's loans from multilateral lending agencies like World Bank, IMF, bilateral loans from country-to-country loans. China is emerging as a major creditor. And then, very importantly, private commercial creditors are becoming among the biggest source of credit for the global South in very problematic ways. And this includes groups like BlackRock, you may not have even heard of, but one of the biggest companies in the world that manages trillions of dollars of assets, based in New York City, HSBC, JP Morgan, UBS, among some of the other bigger ones. But there's other private creditors, manufacturers, exporters, suppliers, regular commercial banks. But these are getting bigger and bigger and bigger as the global South countries are looking for ways to keep themselves afloat. And these private creditors are creating all kinds of headaches. This is just a graph that shows almost 2.5 times as much debt in sub-Saharan Africa come from private creditors across the continent. I want to talk just briefly about 3 specific cases. Now, one of the problems with private debt the private creditors is they don't go along. I'm going to be very critical of what the IMF debt relief arrangements are, but at least they're something. They're helping in some way. Private creditors don't go along with those on average. And they say, no, we're going to sue these countries for not paying back their debts. And we're not going to go along with these debt relief mechanisms that the other public creditors are doing. And so this is creating huge, huge problems. And two countries, Zambia and Ghana, have recently gone into bankruptcy, two of the first countries to do that. So I'm going to talk a little bit about that. But first, I want to talk about Mozambique as a specific case of austerity. I have to go they're complicated backstories, but just briefly. Most recently, Mozambique suffered something they call the secret loan scandal, which has been this huge issue in Mozambique. The Credit Suisse, bankers from Credit Suisse, it turns out, bribed the Mozambican finance minister and other officials in the government secretly to provide $2 billion in debt to buy tuna boats and military equipment. So it's also called the tuna boat scandal. These were secret; they were not passed through Parliament, but the debt went on to the ledger of the government, and it has led to a period of about 5 years of extreme austerity, right? And so this is kind of a microcosm of some of the corruption that goes on behind closed doors around the creation of debt across the global south. Not that all debt comes from these kinds of bribery schemes, but the Credit Suisse guys, several of them have been convicted in New York and in London. And just 2 weeks ago, the Mozambique finance minister, Manuel Chang, who's been actually incarcerated for 2 years, was just finally convicted in New York courts and might be extradited for prison time in Mozambique. So some very deep, dark stories here about debt. And this is a specific instance, but Mozambicans say, the only thing unusual about this particular scandal is that it was discovered. And the sense in many countries is that this is kind of the way business is always done. What's unusual is they got caught. But it was initiated by the Credit Suisse guys who, came to them and said, hey, we're going to give you a cut of this. There's going to be kickbacks. So it's just the ugly side of loans. But what it's done has led to the contraction of services and education for millions of Mozambicans, right? So it's a really terrible, terrible story. In part because of that, in part because of COVID, there is now a new austerity regime that has been imposed by the IMF, new agreement starting in June, just 2 months ago in Mozambique. And it is a shrinking budget envelope for health worker salaries, for basic routine costs. And I got to interview the Vice Minister of Health on this last visit, Iles Johnny. He wanted to speak on the record. And he said, we've never had a crisis of this kind before. We can barely keep the health system functioning. Doctors are preparing for a massive national strike. There's already been strikes of the other healthcare providers. So, and this is all really a consequence of both the secret loan, but then the COVID punch in the gut, which just really undermined the whole economy. So our experience as HAI, we've worked there for 30 years and seen how austerity works on the ground. And one of the domains of this is that the public sector is so starved of funding that all the talented doctors and nurses are looking for a way out. So they join well-funded NGOs, they join aid agencies and that kind of thing. You can't blame them, right? They want to make some money, but the salaries that are paid by NGOs for, say, a doctor, a Mozambique doctor, are 6 to 10 times as much as you get in the public sector. So who's going to turn that down? The resource and infrastructure shortages, long patient waiting times. Rachel and I did a project on HIV care and treatment for pregnant women in one site. It's the epicenter of the HIV epidemic, where an NGO, American NGO, got all that for money to do the work. And the average wait time for a pregnant woman to get HIV test in neonatal care was 7 hours, followed by an average of a 5-minute consultation. And that was it. And it's like, where's all the AIDS money going? It's not going to the health system itself. And then, health workers are so badly paid, they can barely make ends meet that they often try to get under the table payments for patients. They sometimes steal medicine and sell it because they have to serve it as well. It's kind of hard to read this. This just shows the up and downs of per capita spending. I'm sorry, this is a little bit tough to read, but the very bottom one is about $32 per capita. It shot up to an amazing level of about $43 at one point per capita in Mozambique. I would just point out that in the United States, we spend $800 per person for our house pets per year. So, the kind of per capita spending we have on health is just astonishingly low. It went way down in 2016 as a result of the secret loan scandal. It came back up and then it's gone down again after the COVID pandemic. So really a tough slog for Mozambique moving ahead because of debt. Zambia is the first country in Africa to default on its debt. It sought support through the Common Framework. And most of its debt, or a huge proportion of Zambia's scheduled debt payments, 42% are to private creditors. Most of that is to this group called BlackRock. About 39% are to Chinese public and private lenders. So it has a different debt makeup now than it would have had, say, 10 or 20 years ago. Lots of private creditors, which are making it very difficult to renegotiate. Even before the pandemic, Zambia was spending 4 times more on debt repayments than on healthcare. So just, again, sort of this very, very direct impact of debt is that you don't get to invest in health. And just some more data here on how debt has increased, and most of it going to private debtors increasingly. So the semi-good news is that a new debt deal was just announced several weeks ago, or about a month ago, and it looks like they were able to wrestle BlackRock down to participate in this debt deal, but it still includes austerity going forward. It means that Zambia is getting some help to dig itself out of this hole, but it's still going to have to be cutting education costs and health costs, and I haven't been able to get the numbers on what's included in the new deal. Ghana, similar situation. Ghana used to be the star of structural adjustment, right? Ghana was supposed to be the country that was doing everything right, and it has fallen on hard times. So it's the second country in Africa to default in the last couple of years. Spending over about 40% of its government revenue on debt service alone, right? And keep in mind, where's this money going to? It's going to Global North banks, creditors, and much of it to extraordinarily wealthy Wall Street firms at this point. So it's even more frustrating. So about 90% of its $1 billion in external interest payments in 2022 had to go to private lenders. Of Ghana's external debt principal payments, about 50%, 56% are to Western private lenders, and you can sort of see the list here, 11% to Chinese. So like Zambia, the semi-good news is that a new deal was reached in June 2024, and so there is hopefully some breathing room there, but again, we're going to see a long period of austerity forcing Ghana to pay back much of this debt. So just, what can we do about this? This is hard. This is a global struggle, right? So it's the global financial architecture. What can we do? Well, we in our little corner of the American Public Health Association in the United States decided we would do something about this. And a group of us developed a resolution calling for debt cancellation. So I'm happy and proud to say that I'll talk about what's in here, but we were able to get that resolution passed and adopted. That is, the APHA is the largest professional organization, public health professionals in the United States. So hopefully someone pays a little attention. And I'll talk about what the provisions are, but the main issue there was calling for cancellation of debt across the global south. There are 2 interesting campaigns, debt law campaigns going on, one in New York City, actually New York State, and the other in London. And the vast majority, as sort of a hearkening back to the days of both colonialism and sort of American domination, most of the world's financial resources flow through and are dominated and controlled by legal frameworks in New York City and in London. That's where the global economy lands. So some clever people in the state of New York, where New York City is located, said, what we can do is we can create some New York state laws that are going to rein in the bad actors in this private creditor world. We can actually make laws that say that these Wall Street-based firms have to play by new rules. So there's something called the Sovereign Debt Stability Act, which is working its way through New York State. And I'll talk about that in a second. And then there's something called the New Debt Justice Law in the United Kingdom, which I don't have all the details on that, but it does a similar thing. It's going to force that, if it gets passed, it has to get through the political process. It will force the private creditors to go along with whatever public creditor debt relief strategies are created by the IMF and by bilaterals, which is better than nothing. And then I want to talk about a third thing really briefly. It's called special drawing rights, or SDRs. There's a coalition to push the IMF to provide more special drawing rights. I'll talk a little bit about what that is. It's extra funding for countries in distress. And there's a big effort among global NGOs and civil society organizations to push this. So here's our brilliant American Public Health Association policy statement. It's actually a 15-page document, which the link is on the bottom there, but basically asking to cancel debt among those countries in greatest debt distress, mobilize extra finances, but very importantly, that fourth one, not just to provide debt relief, but reject the imposition of austerity programs, which are cutting spending on basic social needs, especially health systems and education. So rejecting that, saying this is a public health issue more than anything. So real briefly, I won't read all this stuff, but the Sovereign Debt Stability Act, if it gets passed through the New York State democratic process, it would create a comprehensive mechanism to restructure sovereign foreign debt and limit private creditors' recoveries on their claims against a sovereign state. That when that sovereign state, like Zambia, says we're going to work with the IMF on this debt relief package, it says that these private creditors, by New York State law, have to go along with that because they've been not going along with it for years, and it's made it incredibly difficult to have meaningful debt relief. So you can see the second bullet point is that this is a really interesting coalition of groups. We have labor. The New York AFL-CIO is the biggest labor organization, trade union organization. The New York State Catholic Conference, so you can see churches, labor, NGOs, humanitarian organizations coming together to push this legislation and to lobby. And the finance industry, Wall Street, is now mobilizing intensely against this. So it's a real political battle taking shape. We have done our little part in our public health people. We're collaborating with our New York State Public Health Association, producing campaign materials and helping them lobby the New York State representatives. So just being part of that campaign as public health people and using our debt resolution to highlight that. And we think we have a chance of winning this. It's not going to transform or resolve the debt crisis, but it's one piece that could help because the private credit piece of this, by the way, they call these Wall Street firms that buy up debt and then squeeze countries dry, sue and get the money out. They call them vulture funds, which signals the kind of organizations they are. Private equity firms are among the worst. They're doing the same thing in the United States. They buy up health organizations, squeeze them dry, cut people to get as much money out of them and leave. And so the state of global finance now is increasingly dominated by these vulture funds. That's really problematic. This is a new twist on international debt problem. These are just images of the campaign. Then the third piece here is there's an interesting coalition. It's civil society proposal for special drawing rights reform. Now, this is a really wonky thing. Special drawing rights is hundreds of billions of dollars that the IMF keeps as bank reserves. I won't go into all the wonky technical details. Desmond, as an economist, I have to help us explain it. But this is actually, these are rights that can be turned into funding for countries to pay off debt or actually even invest in certain public institutions. So these organizations, these are just some of the ones that are involved. It's a global effort. ActionAid is leading the charge. Partners in Health, Paul Farmer's old organization, our Rwanda folks in the room here will remember Partners in Health, but they're a big footprint in Rwanda. But a number of other organizations around the world trying to push for this is a specific piece of the IMF role is to push the IMF and the G20 to support the idea of using special drawing rights, hundreds of billions of dollars to relieve debt. In fact, these were used, the last allocation of SDRs, is what they're called, $650 billion released in 2021 to help countries fight the COVID pandemic. And what these organizations are saying is far more needs to be released going forward as we fight with this latest debt crisis. I'm going to switch gears and then I will be done shortly. Slightly different issue, but I want to talk about how it's related to this. So because countries like, for example, Mozambique has these very, very strict constraints on government spending, what can go on their government budget, international aid by and large flows not to government budgets, but gets diverted to mostly to NGOs and other private non-governmental actors, because the IMF and the austerity measures say we have to keep government budgets small. So we've seen a proliferation of NGOs all across Africa. I think everyone here is familiar with that. Hundreds, if not thousands of NGOs feeding off the foreign aid gravy train that's flowing to them. And so in our work, Rachel and I have seen over 30 years, these incredibly well-funded American NGOs with tens of millions, sometimes hundreds of millions of dollars, working side by side, trying to strengthen a health system where the health workers haven't been paid in 3 months because the government is broke. There's this terrible imbalance of money flowing to NGOs versus the amount of money going to public sector systems. I think it's probably familiar to many of you here. So how do we change that? It doesn't get talked enough about in the world of global health. What is being talked about now is localization of foreign aid. There's been quite a call to decolonize global health that many of you have probably heard about. We don't know what that actually means, but somehow shifting the power balance from the global north to the global south. So people have said, let's localize our funding, channel more global north funding to local organizations. And usually what that means, as it turns out, is NGOs. They're not rechanneling money to public sector systems like the National Health System in Mozambique or the National Health Institute, which does research. They're channeling it still to these big American contractors and NGOs, but shifting now to local groups. So I want to talk just briefly about that dynamic. I'm talking mostly about US funding now. Just a quick note, PEPFAR is the President's Emergency Program for AIDS Relief. That's the big American funding for AIDS treatment, prevention and treatment, which is the biggest global health funding the US has ever provided. It's billions of dollars a year to about 25 different countries. 95% of PEPFAR funding goes to American contractors and NGOs, right? So big problem right from the get-go there. So there's some discussion effort. USAID, the American Development Agency, these are the biggest donors in the global health space in Africa. USAID, they say they want to now shift to 25% of their funding by next year to local entities and NGOs. It's not going very well. They've got about 7%, something like that. But many of us who work in places like Mozambique and in the global health space are saying, why do we have to create yet another layer? It's nice to fund local NGOs, but they're not a replacement or substitute for a well-funded national healthcare system, right? Or this really well-funded and well-functioning public sector institutions. So that's part of the struggle going on around austerity and debt. That during this time of terrible debt, let's cancel the debt, channel more resources into public sector systems. And this localization discussion needs to be pushed more in that direction. Right now, everyone's talking about how do we get more money to local NGOs. Now, I have Health Alliances International story as that fourth point there. I just mentioned early on that we handed over all of our projects to local NGOs. So we're part of that process. We wanted to do that in the spirit of localizing and decolonization and all those kinds of things. But we do feel a little compromised. These are organizations that we think are going to work very closely in close collaboration with the national health system, but we would have preferred to rechannel our grants and contracts to the public system we're trying to strengthen, but our donors won't let us do that, right? So we have this conundrum. And So I won't talk about this graph, it's a little misleading of PEPFAR money, but they're trying to make the case that they're increasing the amount of money going to local agencies, but in fact, they're not doing a very good job yet. Real quick, final slide here. Creation, what this has led to as well is the creation of mini-me's. I don't know how many of you remember the Austin Powers movies, what was that, 15, 20 years ago, but there was a character who created a mini-me version of himself.
Yeah.
And this is the word that literally the vice minister said. When I asked him, well, what do you think about localization? He said, well, they're just creating mini-me's, right? So a big organization like ABT or ICAP, which comes from Columbia University, they create their local version of themselves, and they end up getting subcontracts going back to them. And our organization at UW called ITech, a separate one, big, huge thing, has created Zimtech in Zimbabwe, Moztech, but they finance themselves back, and they want to do the right thing, but it's what's really happening is anything really changing? Is this decolonizing global health in any meaningful way? But also with this new proliferation of new local NGOs springing up right and left to jump on the new funding, you have the same issues, brain drain. They're hiring the most competent people out with high salaries because they get a big grant from AID. The fragmentation of the health system and not collaborating well. And of course, just the diversion of basic resources away from the public system. I won't talk too much about this now, maybe Q&A, but our experience of just transitioning to local NGOs was fraught with incredible challenges. AID gave us huge challenges. We had to really argue with them on why we should be able to do this. So just getting to local NGOs was hard enough, but total prohibition on re-channeling this into public institutions. So we're going to end with another African voice. This is Ivo Garrido, who during a speech, we said, what do you want to tell global health people? What should we be doing? And he said, health systems are a country's mechanism for taking care of its people. If you want to help strengthen the national health service, don't give all your money to Save the Children and CARE. Sorry, I'm not naming names here. As we say in Mozambique, obrigado. This is just a shot in Beira, second city of Mozambique, child health nurses who are truly the heroes of this whole enterprise, with people who have been perhaps waiting 6, 7, 8 hours to have their children weighed and vaccinated because they know it's valuable, and just a handful of people paid sufficient wages to actually bring them the care that they need and deserve, and hopefully we can make some progress. Here's just a few key links. We can share this with people who are interested if you want to learn more about debt and austerity and health system strengthening. And again, some of the people involved in the resistance and doing the kind of political work and lobbying. There's just some wonderful organizations doing a lot out there. So here's just resources for action. So I will stop there. Hopefully,
Right, thank you very much. Thank you. I found that extremely important, very interesting, and also very important. Some sense of desperation that these deep structural problems that you reveal with, and yet sort of superficial responses. But what I liked was the two things. I mean, one was that actually some attempts to make a structural response and taking it on as a political issue and as an issue of law, a global law, meaning London and New York, but also looking at the other aspect of it, the localization, taking things right down to local level. So I thought it was depressing in one sense, but encouraging in another, because actually there were good, interesting, optimistic initiatives.